So good morning to everyone and welcome to this very first broadcast. One of the reasons why we started thinking about having this platform is really to give parents accurate information during this time where we are bombarded with a lot of news. We don't always know what we can trust and what is accurate and what is fake news. So really to provide our parents with accurate information. And I think as we go on through the next couple of weeks, it's also about giving people strategies and tips for coping during lockdown and with the COVID-19 virus and everything that goes with that. So I've got two very special guests with me. I've got Athena Clayton, who many of you might know. She is the psychologist in the primary school in grade 1 to 3. And then we also have Dr. Angela Ajumarcos with us today. Good morning to you all.
Morning.
Good morning, Fred. Morning, Angela.
So just to give you a bit of background on Dr. Angela, she did her medical degree at the University of the Witwatersrand in 1996, and she also continued with her honours degree, BSc honours degree, at Stellenbosch University in 2001 in reproductive medicine in palliative care of cancer patients. She's been a general practitioner for 23 years, so she really knows her stuff and can give us an update on what we are dealing with at the moment. I also just want to add that Dr. Angela has got her grade 8 UNISA piano. And obviously she's also one of our parents at SAHETI with her children Stelio and Eleni, who've been at school, alumni 2017 and 2019, and with Katrina now in grade 9. And also her husband being in the retailing business and an accountant. So we're very privileged to have you here, Angela. Thank you very much. I think just to start our conversation, how did you first hear about this COVID-19 virus?
Well, we watch Sky News in our house every day. So I think the first time we heard about it was on international television through Sky News. And at that stage, I think it seemed like a remote, distant virus that was happening on the other end of the world. I think that's the same for everybody. And at that stage, we really didn't realize that something like this would ever happen. I must say, Lancet Laboratories sent me an email early in January to warn us about the virus. And they could see that it was spreading in China. At that stage, there were only 200 cases worldwide, but I think there was concern because there were a number of cases that had actually gone to other countries, especially from Wuhan province in China. And so we were already warned early on in January through Lancet Laboratories that there was such a thing as coronavirus. And they already at that stage told us how it would be tested, how it would actually be treated currently at that stage, and what we should look out for as far as clinical symptoms are concerned. And that should we think that anybody had traveled from Wuhan province, that we should actually alert the authorities and that it would be a notifiable disease in South Africa.
I remember with the previous kind of outbreak that we had with the SARS virus. Do you know if there were any cases of the SARS virus in South Africa?
Not to my knowledge. As far as I know, we didn't have any here, but I stand to correction on that.
Was there at any point that you thought this was going to become such a global epidemic?
At no point did we think that it would get to what it is now. What's happened in the last few months worldwide has been nothing short of frightening. And I know that there have been previous epidemics or pandemics that have hit the world throughout its history and hit mankind throughout its history. But I think because of our modern society with social media, with television networks that are bringing us news as it happens around the globe, I think that we have become very aware of this threat in a very short period of time.
Yes.
And the media have created a huge benefit on one hand in informing us all and educating us all about the risks and educating us about the possibilities of what this virus can do. But at the same stage, I do feel as though, unfortunately, the media have also created a huge frenzy and, created a lot of fear.
Sure.
I'm so glad you say that, because that's something that Fred and I have often said to one another. And I think one of the things that is so often taken away from news programs is, oh, this is just the flu. Can you tell us a little bit about what COVID-19 actually is?
Okay, so COVID-19 is a virus, and unfortunately, as we all know, viruses are very difficult to treat, quite difficult to even diagnose. But in the end of the day, this is a virus that unfortunately has been dominated by respiratory illness, which means that it seems to attack the airways, it seems to attack the upper airways, and it seems to attack predominantly the lower airways. That does mean that 80% of people are experiencing normal flu-like symptoms and will convalesce and will be able to actually get over it on their own at home. Which is why a large amount of people are saying, but what is the big hype about this is just a flu? In the end of the day is that 20% of people will actually run a complicated illness with this, with a smaller percentage requiring hospitalization. But worldwide, through the countries that have been through the epidemic before us, unfortunately, we've seen that those 20% of a population certainly inundate healthcare workers and healthcare facilities. And I'm not concerned about the 80% that will get over the flu at home in their own capacity. I am concerned about the 20% of the population. You do the numbers, 20% of our population of 57 million people is a huge amount of people that will be presenting to hospitals, that will be presenting for some kind of healthcare assistance. And a large percentage of those will need hospitalization. And that's not just normal hospitalization lying in a bed with a few nurses and a doctor taking care of you. That is intensive care hospitalization, needing ventilators, needing specialized equipment, needing expensive drugs, needing expensive tests in order to actually monitor their illness and in order to get them through it. And because it's also an extended illness, we are now saying that people that have got COVID-19 virus do actually land up shedding virus for up to 3 weeks or 21 days. And so because of that extension of the illness, it's a long time that that person also needs to be spending in hospital. Sick patients that finally develop the very, very complicated acute respiratory distress syndrome, which is ARDS, unfortunately will land up in hospital for even extended periods of time, provided that they can get the support that they need and provided that they are improving. And so this is going to exhaust our healthcare facilities, our healthcare workers. Unfortunately, in South Africa, we also have a very, very short ratio of patients to of doctors to patients, and so the healthcare workers will be inundated and the healthcare facilities will be inundated should this virus get out of control.
So Angela, I'm hearing that you're quite concerned about this trajectory of this virus. I think, you know, with a lockdown, it's 3 weeks, and perhaps psychologically people are thinking, you know what, we just get through these 3 weeks and everything is back to normal. What's your take in terms of flattening the curve and the trajectory of this virus?
I think I am a very optimistic person, and I like to always think positively, and I think that's really, really important that we should be doing that, especially at times like this. I think that our president has been absolutely phenomenal in creating this lockdown at an early time. It's almost unprecedented at such a low level of cases to have taken such aggressive action, and I commend him for that. I'm certainly grateful for that. I am, however, not particularly of the opinion that we are going to get rid of coronavirus in 3 weeks' time. I'm not naive, and I certainly believe that hopefully through these measures, and if everybody takes it seriously enough, we will be able to so-called flatten the curve. So what flattening the curve means, and everybody's been hearing that terminology, is that we have a certain curve where we draw a line horizontally in that curve where the healthcare workers and facilities will be saturated. In other words, that would be their capacity. And at this stage, hopefully, we are still falling underneath that flat line. The curve is rising, but hopefully we are still lying underneath that flat line. Should we go past that flat line and continue to rise, then obviously we're at a stage where our virus and our sick population have exceeded that flat line. And so what we are trying to do through these measures of this 3-week period, and perhaps even a little bit longer, is to try and, first of all, prevent that viral load of getting past that healthcare line, or else at least staying at that healthcare line and giving the health professionals and the health facilities a chance to actually cope with what they are dealing with and not be overwhelmed.
Athena?
I think you explained that so nicely, the flattening of the line, and I really appreciate you telling us a little bit more about COVID-19. I think one of the things that people seem to have really been struggling with is how do we explain this to our children? It's one thing for us to understand it, and we can understand the figures, we can understand the enormity of it. How do we explain it to our children without making them feel alarmed and overwhelmingly worried about what is happening in the world around them? Well, could you tell us a little bit about maybe what you've told your children about this situation?
Sure. I think your valid question is causing a lot of concern to parents. I don't believe in holding things back from my children. That's just a philosophy that I've taken. My children are older. They're both at varsity, and then my daughter, that's in grade 9. So we've had open and honest conversations about it. They're also watching the international as well as national news networks, and reading things on their cell phones to a large extent. So they are very much aware of the threat out there and very much aware of what is busy happening in the world at the moment. I think it is more difficult in younger children who maybe don't have lessons in biology to teach them about viruses and to teach them about bacteria and how these things work or how they are transmitted. But I think that, I remember my children learning about the concepts of germs in pre-primary, and I think it's really important that we teach the children the concepts of germs and washing of hands, as well as hygiene rules around the house when we go outside in the garden to play, coming back inside the house again, hygiene rules before eating, and just, yes, definitely tell them about this latest coronavirus, because they need to know why they're staying home from school, and they need to also know why this has impacted their parents' lives and why their parents are all of a sudden at home with them as well. And I do believe that it's important that they are aware of the times that they are living in right now.
So, Angela, I've got a couple of questions. Fact or fiction? This virus, is it airborne? Can we get this virus by just being outside? I've received a WhatsApp last night on our community group here in our complex that says this thing is airborne. Is there truth in that? Or is this fiction?
I also saw that it was from CNBC that was passed around yesterday. And I'm cautious to actually believe news networks as such before I see it on the World Health Organization website, or before I see it on our own NICD website, which is the National Institute for Communicable Diseases, that have kind of taken control of this in South Africa. And I like to believe in science, and I like to believe in evidence-based medicine. And at this stage, because this virus is so new, we are learning new things about it every single day. And I think that we should be cautious to believe news network sites or possible propaganda on social media before believing proper scientific websites and proper world authorities on the matter. So I'm not quite sure if it is completely airborne. They're talking about procedures in hospitals and procedures in ICU where doctors or where healthcare workers could possibly be exposed, especially when there are certain procedures taking place. And I think that those doctors and healthcare workers should be wearing the correct personal protective equipment or PPE in any case. Hopefully they've had access to it, and in which case they should be taking the right precautions. As to whether everybody walking around, going to the shop or putting petrol in your car needs to be concerned that it's airborne, I think we will have to wait for further studies and further confirmation on that.
Sure. And how long can this virus actually survive outside of the human body?
Well, there's certain studies that have been done on surfaces, so looking at metal surfaces, plastic surfaces, cardboard boxes, because all these things exist in a hospital room. All these things exist on my desk at the practice. All these things exist in our everyday lives. And, you know, it's important even for the person who has mild symptoms with COVID-19, staying at home for their family as to what that person can touch and what that person, you know, where the virus could possibly be surviving on surfaces around their homes. To a large extent, they've done interesting hospital studies where they swabbed doctors' coats on the way out of patients' rooms. They've swabbed the floors, they've swabbed bathroom areas, they've swabbed the metal containers in the room, they've swabbed everything. And they have found that unfortunately, coronavirus does continue to exist on certain surfaces. Medscape is a good website to look at, and they have published exactly timelines on how long the virus can exist on certain surfaces. But it can be anything from a few hours to a few days. So every precaution is being taken.
I think we're also reading quite a bit around nutrition and immunity. And there are particular reference to vitamin C and zinc, etc. What's your take on these nutritional supplements? Do they make a difference? And if you also can maybe say something about the treatment that we are hearing about. President Trump in America is certainly advocating for the anti-malaria medication. Tell us a bit more about that.
Well, I think this is what the world is grappling at straws with, in that how can we possibly treat this horrible virus? And we've long known that vitamin C does improve immunity, although there are many studies to refute and also, on the other hand, support that. So I don't see any harm in patients taking vitamin C as a supplement. I think it could possibly be good for your general immunity. But specifically towards coronavirus, there have been, I saw a published study from a pulmonologist in West Virginia yesterday from the United States, one of his hospitals, and he is advocating the use of vitamin C even in hospital patients. Zinc and chloroquine. Chloroquine is the anti-malarial tablet that we have known about for many, many years. In fact, when I was still a medical student, chloroquine was the drug of choice for malaria prophylaxis in South Africa. Obviously, newer things have come out over the years, but chloroquine has been around for a very long time. And the French actually discovered that and a French study has been published, that there is a possibility that this drug might help in coronavirus patients. So there is a beautiful video being sent around that you can possibly look at on YouTube about how zinc and chloroquine actually do help. It gets into really tough molecular biology jargon and so forth, but it really just simply means that chloroquine forms the bridge in order for zinc to cross the cell membrane and enter into the cytoplasm, where it could possibly stop the virus from replicating. So the combination of zinc and chloroquine is quite promising at this stage. Medical studies and pharmacological studies take a huge amount of time, effort, and economics. And at this stage, we don't have time, and we don't have a huge amount of finances to throw at this. And in which, in the end day, a lot of hospitals, ICUs, and so forth are instituting the use of zinc and chloroquine. We were sent an email from the Health Professions Council of South Africa this week with alarming news that a huge amount of people have gone around bullying pharmacies, bullying GPs into prescribing chloroquine. The recommended doses of chloroquine at this stage, using it for coronavirus patients, are in mega doses, and it requires monitoring on an ECG in hospital. There is no way that anybody should undertake taking chloroquine at home without the correct monitoring and without medical supervision. So we have been instructed and guided by the HPCSA to not unethically prescribe this drug, and definitely leave it up to the hospitals and the doctors in the hospitals treating very sick coronavirus patients with this method of treatment, hopefully in the hope that it will help. I really strongly would ask everybody in the general population to not go out and try and get your hands on chloroquine and plasmaquine and try and self-dose at home. I think we're going to be extremely dangerous if we get into that situation.
I think a very important point that you're making there, that even these medications do have side effects, and people might not know if they are susceptible to having those side effects, and that can be life-threatening in many ways.
Absolutely.
Mm.
There are certain drugs also. Sorry. There are certain drugs like the antivirals as well that are also under investigation. And interestingly enough, because in South Africa we have a huge, sorry about that, because in South Africa we have a huge population of HIV positive patients that are possibly already on antiviral. I think that in the end of the day, it will be interesting to see how those patients respond to coronavirus.
Sure.
Yeah, definitely. It just, when you were talking about the way that the public were reacting to the news about the chloroquine and going to the pharmacies, I think it just also reinforces how important it is to seek the medical advice and not just to go by media reports, which they may not understand. So they may think a small dose of chloroquine would be enough.
And it certainly
and
isn't.
It's so interesting what you're saying. So thank you.
Angela, so we've got a couple of minutes left. I'm very curious around the flu vaccine. Should we be getting this flu vaccination at this particular point? What are your recommendations?
I recommend the flu vaccine every year, coronavirus or not. And at this stage, there's certainly no harm in taking the flu vaccine. And at this stage, we have been recommending it to patients who ever can get their hands on it. Unfortunately, I have it on authority from the reps at Sanofi that 2 million flu vaccines were ordered for South Africa this year for our winter season. And we're a population of 57 million people. So there is no way that everybody's going to get their flu vaccine. I think that it is extremely important for people in the healthcare professions that are dealing with people every day to certainly try and get the flu vaccine. And then I think it's quite important for the elderly, people over the age of 65, and possibly the very young children who are susceptible to a severe flu-like illness. Unfortunately, I have been inundated with requests from patients this entire week. Where can we get hold of the flu vaccine? Unfortunately, pharmacies have already run out of stock. I had to even get my flu vaccine at a local pharmacy down the road because I did not receive my stock from, the big pharmaceutical wholesalers. So I really would advocate that you get out there as soon as possible, but phone ahead because you can't go and stand in queues at the pharmacies asking if they've got flu vaccines. So please just phone your local pharmacy and see if they've perhaps got it, and then see if they would be prepared to give it to you. I know that they are preferentially giving it to people over the age of 65 and healthcare workers.
So, Angela, we saw our Minister of Health say that we can expect that there will be very large numbers. Should our families, be affected by the coronavirus? If we've got a family member that's infected, how do we manage the home environment? What are your recommendations?
There's an excellent write-up on that on the NICD website. And I would strongly encourage anybody who perhaps has a positive member of their family to please go to that website and look at their latest guidelines. It's a 2-page document, and I think it is really easy to read and easy to follow. It's general rules about, cleaning surfaces in the home, keeping that person at distance, if that person should be wearing gloves and masks, as to whether the rest of the family should be wearing gloves and masks, eating routines, washing of hands, etc. And I would strongly encourage everybody to go and have a look at that website because it's pretty self-explanatory. And, if you do have a positive patient at home, print those 2 pages out and have them stuck up on a wall somewhere, because then everybody can easily read them and follow the rules accordingly.
Okay, that's useful. So, Angela, you know what? I salute you as a doctor. I can only imagine how stressful this time must also be for you. So, for you and all our healthcare professionals, thank you so much for everything that you're doing. I'm quite curious if there is some time for self-care and just some downtime. How are you keeping yourself busy during this lockdown?
I just want to say that, you know, this is novel for us as healthcare workers as well. We didn't learn about this in a textbook. We didn't learn about this at university, certainly not 23 years ago when I was there. And I think that at this stage, we are just as scared and just as cautious as what you are. And, you know, we are all in this together. And I think that through supporting one another, we certainly will get through this time. And I think that the most important thing is that, you know, we need to spend time with our families. We need to spend time reflecting on our lives. We need to spend time on realizing what is important to us. And I certainly am spending time with my kids at home. I'm using this opportunity. I'm at the practice and they're very scared when I do come home. I'm taking every precaution possible. My husband is in the food industry and in supermarkets, and so he's also out there, and the two of us are both essential services. And so our children are understanding of the fact that their parents have to actually do their jobs at this point in time, although it's pretty scary for them too. And I would just say, spend time with your kids, play board games, spend time outside in the garden, which you definitely are allowed to do, by the way, skipping, exercising within the confines of your own home, and definitely, you know, just asking each other how you feel every day and touching base with each other. Teach your children domestic chores. A lot of us have actually allowed our domestic workers to stay home with their families. And I think at this stage, my kids are, you know, climbing in and helping to make food and helping to actually, you know, keep the house clean. And I think those are vital skills that our kids need to learn as well. And to a large extent, their academic and sporting timetable doesn't necessarily afford them the ability to learn all of these things. So experimenting in the kitchen and spending time together doing those kind of things, I think is really an awesome opportunity at this stage.
Good stuff. I thank you for your time, for the really valuable information that you've given us. I really do appreciate it, and I wish you only well during this time. Please keep safe, and thank you for making a huge difference.
Can I just say thank you to you and Athena? Thank you for setting up this podcast. I think that it is absolutely awesome what SAHETI has done over this time. And I salute you as a school, and you know, with the online learning program, as well as with this incentive, Fred. And I think that it is really awesome that we touch base as a community, as a school community, as we are one family to try and help each other through this time.
Exactly. So thank you very much.
Thank you.
Athena and myself will be in contact very soon with our next broadcast, where we want to really unpack a bit more about how do we actually cope with this lockdown, you know, and the cabin fever. Is that a real thing even? And how do we establish boundaries? So please keep a look out on our Facebook page, and we'll see you soon. Thank you guys, and have a good day.
Cheers.
Thank you.